I'm Dr. Colin Graney. I'm a fellowship-trained foot and ankle surgeon. I am married. My wife Rachel, she's a child life specialist at UW in Madison. And then my little son, his name is Sam. So I decided to become a doctor in 7th grade. It was one of my first science classes, and we got to look at how the lungs work for a pig. And then we also got to look at a heart. And so at first, I kind of fell in love with anatomy and kind of how everything worked. It was really fascinating. And that's when I decided to become a doctor. The way I approach patients is mainly just letting them know all the options. I don't like to pigeonhole somebody, and so I really encourage them to be part of their decision making. Just letting them know these are the options we have. If it was me, this is what I would do. I might try to steer them in the right direction, but overall, just making sure that they know options A through Z and making sure that they know and are highly involved with their care. So basically, I treat everything below the knee. One of the more common injuries I see from young athletes are sprained ankles. Something as simple as that, where if you don't treat it appropriately, some of the long-term outcomes can be rather detrimental to their overall happiness and even their ability to play sports at the next level or even for the rest of the season. I see a lot of trauma, especially during the winter time. A lot of broken ankles, so sometimes those need to be treated surgically, sometimes they can be treated non-surgically. But excluding trauma, a lot of what I do is cosmetic or plastic style surgery, whether that's bunions and hammer toes, ganglions, soft tissue masses, even just your run-of-the-mill Achilles tendonitis or some of the basic things that I do treat. It's best when someone comes in and I always say, "How are you doing?" and everyone goes, "Not great." So hopefully the idea is that they can walk out being much happier, especially when someone's being treated surgically and they come in and they say that they have no pain, they feel great. It's really nice to kind of get them back on their feet, get them back to normal, and let them do the things they want to do. Ankles are now becoming very, very common to talk about ankle replacements. It was one of those things that were not as common in the past. Everyone knows about knee or hip replacement, but it's now 2020 and times are progressing. So as time goes on, the technology is now developing where we can actually now replace an ankle. Historically, people used to fuse ankles, and not everyone liked it because you would lose the range of motion. Now people come to me and they say, "Someone offered me an ankle fusion, but I want to keep my motion." And that's when I talk to them about ankle replacement, which is you see their eyes open, they get excited because they can keep that mobility and try to stay a little bit more active than a typical ankle fusion. Not everyone's a candidate for an ankle replacement, but the ones who are, becomes a great option. It's just kind of fun to see all the different pathology, and so now that you're seeing a massive influx of patients who need to have these issues addressed, and so it becomes just fun to meet people and kind of get to know them and get to learn about this community.